Welcome to Season 2, Episode 10 of the Home Healthcare Today show. I am your host, Dr. Cleman Moore. And in the month of May, we have a wonderful opportunity to focus on women's health.
All right.
Yes, it is my distinct pleasure to be accompanied by Dr. Kimberly Farrow of Central City Integrated Health. Dr. Farrow is a board-certified internal medicine physician. Dr. Farrow earned her Bachelor of Science degree in Sociology and African American Studies from the University of Notre Dame in 1999, and her Certificate in Biomedical Studies and Research from Southern Illinois University in 2002. Following undergraduate studies, she moved to Michigan, where she earned a medical degree from Wayne State University School of Medicine and completed her residency at Wayne State University's Detroit Medical Center. With a passion for the city of Detroit and a desire to affect real change, Dr. Farrow is committed to giving back to the residents of Detroit. For the past 4 years, she has served as an assistant professor with the Wayne State University Physician Group, where she works closely with the internal medicine program director and faculty to build new and innovative partnerships across a variety of clinical and academic healthcare disciplines to support the academic programs. Dr. Farrow has established a distinguished and successful track record in hospital administration in Metro Detroit. In 2013, she was appointed medical director of Salvation Army, Harbor Light, Southeastern Michigan, Wayne, Macomb, and Monroe counties, and medical director at Gateway Detroit East Integrative Care. In 2015, she was named Chief Executive Officer of Detroit East Health Services Integrated Care, where she serves citizens who are marginalized in our society because of their economic status. She provided primary care services, designed and developed an integrative electronic medical record system that improved communication and dissemination of information between healthcare providers, social workers, psychologists, and other key medical staff. In October of 2016, Dr. Farrow was named Chief Medical Officer and VP of Clinical Operations. Congratulations. At Central City Integrated Health, where she is working to change the paradigm of health care in the community. High quality care and housing for every person, regardless of their socioeconomic status. She is passionate about improving health and housing for vulnerable populations in Detroit. In most cases, she is the first contact for individuals who, because of their behavioral health challenges, have never received primary care services. Dr. Farrow is a member of the American Medical Association, the American College of Physicians, Society of General Internal Medicine, board member of the Salvation Army Harbor Light Advisory Board, and Hope of Detroit Academy Board. She received recognition by the Wayne State University Detroit Medical Center Outstanding Patient Care in General Ambulatory Practice. Dr. Farrow also received a Leadership Award from Payne Pullman for Outstanding Community Service. Dr. Farrow is the proud mother of a beautiful baby boy, and she resides here in Metro Detroit. Dr. Farrow.
Thank you. Look, you make sense to sound good.
Yes, ma'am, indeed.
So just a couple changes. I am now the president and CEO for Central City Integrated Health.
Hey, congrats.
Yeah.
Yes, ma'am.
So, yeah, that change went into place 2020. So
Yes.
that's my new role here at Central City.
Awesome. Well deserved. Well deserved.
Thank you.
Dr. Farrow, congrats on that appointment as president and CEO here. Tell us a little bit more about you, Dr. Farrow, in terms of your passion for Detroit, your passion for women patients, as well as public health.
Wow. So I always tell people that I feel like I got sucked into the vortex, after I finished residency and chief residency. I was looking for jobs, but I had really, in residency, you start your practice. You get to know the Detroit community, you get to know the patients. And I just fell in love with the community. And so, when thinking about leaving Detroit, I just decided to stay here. I kind of got sucked into the vortex and,
Yes.
you know, made Detroit my home.
Right.
You know, I'm really passionate about addressing care for at-risk populations, right?
Yes.
So people that typically don't have access to high quality healthcare services, people who are marginalized, people who don't really know which resources are available to them in our community. And
Yes.
so through my work and through integrated care, we've been able to connect people to those resources. So
Yes.
I'm really passionate about that. I'm really passionate about integrated care, and it's really in part why I decided to stay here in Detroit.
Wonderful.
There's just so much need,
Yes, ma'am.
so much opportunity.
It certainly is. Dr. Farrow, granted that it is Women's Health Month, we also have various students who watch our show, as well as listen to the podcast. And we want to keep students inspired as well,
No.
right? Yes. Please, yeah, share with us some of those challenges along the way. Once you decided, hey, I want to be a medical doctor, some of the challenges and obstacles, and then, you know, how did you overcome some of them?
How long do you have? I mean,
You know.
so
Yes.
yeah.
Yep.
I always knew that I wanted to be a doctor. And I was fortunate enough to have parents that, you know, helped me navigate that in terms of making sure that I had good grades and making sure that, you know, I had exposure to healthcare and the medical field early on.
Yes.
So I was really fortunate in that. But I think that for that, I don't know if my experience, in fact, I know that my experience for many young Black and brown students, my experience isn't the typical thing,
Yes.
right? So how do you get into medicine? Well, you know, I think firstly, you know, getting good grades is always is key. You know,
Yes.
having a track record of excellence, having, you know, proving yourself to be able to manage difficult curriculum, I think is really, really important. But I almost would put above that is having a mentor in medicine,
Yes.
right? You need someone that has actually blazed that trail, that actually has done that work to help navigate your process.
Absolutely.
I can't say enough about all the people that have helped shape my career, that have helped mentor me. And I think without their influence, I know for a fact I wouldn't be here, right?
Absolutely.
So,
Yes.
you know, good grades, yes, but mentors, definitely.
Yes, ma'am. Wonderful, wonderful. And I know that the young people watching, right, oftentimes, you know, think that they can't offer anything to a mentor, right? Yes, but we want them to remain encouraged, to know that the energy and the time that the mentor puts in you, it's for you to take it and move it forward. And then at some point, when you're in position, to be able to pay it forward to those coming behind you.
That's right.
Yes. Dr. Farrow, when you think about women and women's health, there are a lot of issues and concerns, right? If you were to summarize some of the top 3 to 5 health concerns for women, what would be on that checklist?
Definitely. So number one, definitely heart disease. You know, cardiovascular disease. We're still seeing increased rates of heart disease and cardiovascular disease within the female women demographic.
Yes.
I think after that, of course, would be things that we commonly know about, like breast cancer,
Yes.
cervical cancer. But I think, and then I also want to mention like gynecological, like sexual transmitted infections and diseases.
Yes.
But I think what we're really seeing an increase in is mental health issues, right?
Yes.
So especially amid COVID, where people were, you know, disconnected from family and friends. And, you know, I think that really brought to the surface a lot of more anxiety and depression.
Yes.
And especially with the advent of social media.
Indeed.
I think
Yes.
women especially are just being really, I don't want to say, I guess inundated is a good word, but you know, we're being bombarded with images of people who have these lavish lifestyles, right?
Yes.
People who have, you know, it's like everyone's beautiful, everyone's rich,
Yep.
everyone's going on vacation, everyone has nice cars, right?
Yes.
And so if you're living in an impoverished community and
Yep.
you know, are struggling to make ends meet, if you're looking at social media and comparing yourselves to these other people, it really does deepen that sense of, worthlessness
Yes.
and depression and anxiety. And so I'm seeing a lot more of that with women. I mean, we're just comparing ourselves to our friends and our family and Beyonce and Nicki Minaj.
Right.
And it's, and all these things aren't really supporting us and feeling good about ourselves, right? Because that self-love is internal, right? It can't come from the external.
No,
right?
it cannot.
It's about us feeling good about ourselves. And so a lot of the work that I focus on now with women is, let's turn off social media.
Yes.
Okay. Let's start doing that internal work. While we're managing the depression, yes, let's get you on the meds or let's get you in therapy, but let's really start doing the work of bringing that focus inside and leaving all that other stuff, on the periphery.
Wonderful, wonderful, Dr. Farrow. I gleaned a lot of key points from that. When we think about self-identity, the self-concept, self-esteem, so that psychosocial intersection of how I feel about myself could be greatly based upon how I perceive others to feel about me, and then that having a negative or more negative impact on health outcomes.
That's right.
Right? Yes. So we got the problem, right? We nailed the problems. Talk about Central City Integrated Health. How does Central City Integrated Health begin to bring about some of those much needed services, right? The mission of, Central City, and then what you perceive to be the vision for Central City.
So I love Central City. I can talk about Central City all day long. So we are what's called a legacy community mental health organization. So what that is we are one of the first organizations in a pool of maybe 10 that were provided funding to address severe and persistent mental illness among at-risk populations. Okay, so we are a legacy CMH. We are a federally qualified healthcare center. So similarly, what we do is we provide increased access and high-quality healthcare services to at-risk populations. We also are an affordable housing provider.
Wonderful.
So we provide access to supported housing, meaning that we help place you and we give you resources while you're being placed. And then we also have affordable housing where we, have based on your income, housing that you can move into that, of course, keeps you sheltered and safe and all that. So our FQHC service lines really consist of housing, as I mentioned, dental, primary care, which is for both adults and pediatrics. We also have a supported employment program, so we actually train folks on things like the janitorial sciences, customer service, and then we facilitate placements within the community so folks, they get good training here, and then we help them find jobs in the community.
Wonderful.
We also have, I can go and listen.
This is wonderful.
We also have a community reentry program where folks who are, who have been recently incarcerated or jailed, and they're trying to move back into the, community and find, homes and jobs and access to healthcare. We help facilitate all that. Wow. So in that way, if I were to describe Central City, we are a one-stop shop, fully integrated healthcare center. There's no one like us. Either you are an FQHC, or you're a CMH, or you're an affordable housing provider, but we have been able to do it all.
What is most impressive about that, and thank you for sharing those insights, Dr. Farrow, as we think about the social determinants of health, right, it appears to me as though Central City has a comprehensive approach to addressing and mitigating the multitude of factors simultaneously to help inner city Detroiters pursue healthier lifestyles, both mentally, physically, socially, and economically. So that is a wonderful testament. To your point, there are great entities within the city, Habitat for Humanity, COTS, Detroit Rescue Mission Ministries, but to know that Central City has that health component to address the mental and the physical health challenges, it's just simply phenomenal. With that being said, we talked a little bit about the mental, we talked about physical health. For the layman listener, what is integrated health in your own words, and how could people be more proactive about integrating health efforts and interventions?
That's such a great question, because I think we often throw around the term integrated health.
Yes.
People are like, oh, I mean integrated health, what y'all doing?
Right.
But really, the goal, the premise is to provide opportunities to access a multitude of services with one visit, right? So, alternatively, what happens is that people go into the primary care, and then they get referred to dental, then they get referred to a mental health provider, and sometimes they get referred to a specialist. And so they have to hop around the community trying to navigate their health care and go to all these appointments. What we do here is provide access to all of those services through in one visit. So if you come into Central City, and speaking to the social determinants of health, we do an assessment of your needs, and we say, okay, Mr. Smith needs primary care. He has a tooth that's giving him trouble, and he needs mental health services. And so, if not on that visit, the next visit, we make sure that you have all those touches, that you have access to all those things. Wonderful. We help you navigate healthcare.
Wonderful.
So that's the integration.
That's the integration. Dr. Farrow, on that note, we'll go to a commercial, and we'll come back from the commercial and talk a little bit more about COVID-19, its impact on Detroit and mental health. We'll be right back.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle-tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today.
Welcome back to Season 2, Episode 10 of the Home Healthcare Today show. And we are still diving into the topic of women's health with Dr. Kimberly Farrow of Central City Integrated Health. Dr. Farrow, prior to our commercial, you detailed very comprehensively what integrated health is, right? And the services offered by Central City. As we think about year 2.5, if you will, of the pandemic, COVID-19, what are some of your thoughts as well as reflections as related to depression and anxiety? COVID-19 has had its devastating impact on the city of Detroit. What do you recommend for listeners and viewers?
Right. I think that's such an important question. One of the things that COVID did for the rest of the world is that it laid bare all of the healthcare inequities that healthcare providers, that the medical community had long been grappling with, that we were acutely aware of, but really had not yet gained the attention of, the world, right? Right. And so I think one of the things that COVID did do, right, is make it everyone's problem, right? Yes. So now it's not just my problem as a doctor or the nurse practitioner's problem, it's all of our problems. So that's the first thing. Yes. One of the things that I think that really rose to the surface was the need for more comprehensive and intensive mental health services, right? Because we know that people really struggle with depression and anxiety during COVID.
Yes.
Moreover, we now understand that Black and Brown communities were disproportionately more negatively affected by COVID outcomes, right? Yes. So we saw a higher incidence of death, right? Yes. And comorbid conditions as a result of COVID. Yes. Okay, so your question is, what do we do about it? I think that, the healthcare community needs to continue to get out there and screen and test and educate about the efficacy of the vaccines, right? Yes. There's still a lot of vaccine hesitancy. People think that, we're injecting, chips and, weird substances into their body, that this is really not about their wellness. It's more about some government experimentation, right? And so those of us who look like the community, right?
Yes.
Those of us who are tied to the community really have to, work with the community, work with people who are afraid of the vaccine, and allow folks to answer questions or to ask questions and make them more comfortable about the vaccine, right?
Absolutely.
With the vaccine.
Yes.
So that's the first thing, right? Continue to go out and do the work. But I think also providing more resources, right? So more access to care. So, for example, during COVID, one of the things that we did was instead of expecting patients to come into our healthcare center to get information about COVID and to get vaccines, we took it to the streets.
Yes, ma'am.
Right?
Absolutely.
We were in homeless shelters, on corners, in schools, in nursing homes. Wherever people would give us access, we were out there educating, screening, vaccinating. So I think, again, it's providing more opportunities for vaccinations, for more opportunities for screening, but also being present there with the community to educate them on the safety and the efficacy of the vaccine.
Absolutely. Yes, ma'am. And that is so important. As a home health care provider, American Advantage, there's 40,000 homebound patients in Detroit. So the need to get vaccines to homebound patients became a challenge shared by all of us across the ecosystem. And then to your point, the education about the vaccines and dispelling some of the myths and the notions that this is something targeted to you that has ill intent.
That's right.
Versus, hey, research has been done by several groups for multiple years to bring forth vaccines.
That's right.
Yes, ma'am. Okay, homebound. So when we think about that 40,000 population of homebound patients in Detroit, whether it's homebound due to debilitating illnesses or the lack of transportation, what do you think about home health care as a means to support individuals who are perhaps disconnected from the mainstream?
I think it's excellent. I think it's really the wave of the future. I mean, I think we're seeing a major shift in healthcare. No longer are patients coming into brick and mortar to engage services.
Yes.
Whether through telehealth, where we're calling you up on your devices, on your computer, or whether we're taking our mobile unit out and knocking on your door.
Yes.
Healthcare has to come to the people. We have to get out there and go where the people are.
Yes,
right?
Absolutely.
So I think it's an excellent access point. I think that people feel more comfortable in their homes.
Yes, ma'am.
I think that, in the next few years, we're going to see more health home care agencies, emerge, and we're going to see, I think, maybe more satellite, smaller brick and mortar clinics, as opposed to these big, 15, 16 examination room clinics. I think we're going to see people take it to the streets more.
Wonderful, wonderful. And the streets and the people need it.
That's right.
You know it. Going into June, I know the focus has been women's health for the majority of our questions, Dr. Farrow. But there's some men that need help too, right?
Oh, yeah.
Yes, and we're prideful in many respects whenever it comes to mental health, annual checkups and exams. What does Central City do to help that male population that may be on the fence about, getting checkups and
Yeah. We see a whole lot of that. I mean, not to be stereotypical, but you would have seen one of the male patients run out the room quick, or from a prostate exam, or
yes, ma'am.
He's running out the door, right?
Right, gotta go.
Yeah, a lot of it is, again, doing that work of counseling, doing that work of educating.
Yes.
Often we bring in peer support specialists. That so other patients that have received services that are comfortable and satisfied with the services that we provide, bringing in community health workers, so folks from the community, within the community, that again have engaged services that can talk one-on-one with patients. So we do a lot of counseling. We do a lot of long talks and Mrs. Smith, this is what we have to do, and here's why. Absolutely. And we found that that's really effective.
This is good. This is good to hear. 2 more questions.
Okay.
Dr. Farrow. All right. Second to last, right? When you think about Central City and its resources, are there any other groups as related or connected to Central City that come to mind to be able to provide support to Detroiters?
We have been fortunate enough to have many fantastic partners. So
Yes.
I would say certainly, Wayne State DMC, Authority Health, the Salvation Army, the U of D.
Yes.
We have, we belong to a network of community mental health organizations. So, NSO, I'm trying to think. New Oakland, Adult
Yes.
Wellbeing. I'm trying to think of a list of them.
Right.
There's so many. Detroit Wayne Integrated Health Network, which is our funder. I mean, there's so many organizations like ours that are out here grinding the streets,
Yes,
beating
ma'am.
the pavement down, doing this work. So, I think if you want to connect with them and our
Yes.
organization, certainly,
Yep.
look up Detroit Wayne Integrated Health Network. We're
Yes.
we're a legacy CMH.
Yes.
Certainly get on HRSA's website. There's
Yes.
a list of FQACs that all do similar work. So
Wonderful. Wonderful. Last question, Dr. Farrow. Legacy, right? Yes. So personally, right? Congratulations on all that you have accomplished. And we're grateful and thankful that you decided to bring your talents to Detroit for academic training and then to stay here and support the city of Detroit and its residents. You give so much, you contribute, right? So much of yourself to the community, right? And we're grateful. How can organizations, right? How can donors, how can partners better support you, better support Central City? And are there some things coming down the pipeline for Central City that we can get involved in to help, to
Absolutely.
support your great work?
Absolutely. I think firstly, please check out our website.
Yes.
It's www.centralcityhealth.com. There we have opportunities for donations. There's a newsletter that we publish where it
Yes.
tells you, upcoming events and all the good things happening at Central City. Some of the newest things we have happening, we've just got some funding for an HIV initiative where we are
Wonderful.
testing, screening, and providing folks with PrEP, which is a preventative medication for people who, perhaps are professional sex workers or are at additional risk of contracting HIV. We also have a hypertension grant where we provide our patients with monitors that they can take home, where
Yes.
we are getting data feedback in real time about their blood pressures
Good.
and their heart rates, and we are working very closely with those patients to ensure that their blood pressures stay at goal. So those are two really exciting programs that we have going on. I think in the upcoming future, you're going to be hearing about some other really exciting news. We have some other
Yes,
partnerships brewing. So
Wonderful.
I don't want to give the spoiler now,
I
but
get
stay
it.
tuned. There's more.
Absolutely, Dr. Farrow. Well, Dr. Kimberly Farrow, you have been a wonderful guest on the Home Healthcare Today show.
Thank you.
Yes, we're honored to have you, and we look forward to following Central City, recommending and referring patients, some of our homebound patients that don't have a primary care provider. We're going to be sure to send them your way.
Oh, thank you. Thank you. We appreciate that.
We
And we look forward to your partnership because, I know this is about Central City, but you are doing great things. So
Thank you.
we're just happy to be standing in your presence and watch you do your work.
Thank you, Dr. Farrow.
You're welcome.
Wonderful. Thank you.